So maybe Dr. Cash, you can go first.
Sure. I'd say that, bear with me, I'm going to give a long-winded answer to this. But, but my dad one time was laughing at me while I was studying for medical school in second year of medical school biochemistry and said, "That's so easy. Why are you complaining of it?" I said, "Dad, when you went to med school, they didn't have DNA yet." Okay, and fast forward to today, when I started my fellowship training, we didn't have a lot of drugs. And it was easy for me to keep up with things. I It's very hard now. It's very hard now when it feels like every week, every month, there's new drugs or new indications, and keeping up with that as a generalist is it's just not really feasible and sustainable. And so I rely on my pharma colleagues and partners, but at the same time, my busy schedule and my lifestyle does not fit with the current sort of mediums through which I'm supposed to be getting information, especially information that I feel like sometimes doesn't really carry the same weight because I know maybe it's a world expert, but it's a very pitched sort of conversation or information and doesn't really give me a chance to sort of um, ask questions about the things that matter to me. And so what I have found is that when I've got a patient, when I've got a doctor like Dr. Lipson or other my local KOLs and experts here who have bailed me out and saved me when I've had a situation go awry and I've got that trust with them and they tell me, hey, you should think about this treatment
Mhm,
and you should think about this, or not only are they giving me good advice, they're also educating me and helping me grow,
mhm,
which is really valuable. And it sticks. It sticks and I hold on to it in a much more meaningful way because it's coming from somebody I trust and somebody who I know and who I work with. And it's also sometimes coming in the context of an actual patient as opposed to just some generic point. When you have a message, an educational message that's tied to a patient, you remember it.
mhm,
And so I have found this sort of forum through which we educate one another has been very valuable for me.
mhm. Awesome.
Well said, Dr. Firozvi. I want to jump on that education point that you just mentioned. You might know that Hopkins sort of has a three-pronged mission: education, patient care, and research. And I think the take home is that the 1104 Health app really facilitates all of that.
Mhm,
Education, as Dr. Firozvi just said. Patient care, which means the patient gets the right therapy at the right time in the right location. Sometimes that means it's close to their home with the general oncologist. Sometimes that means it's with us on a clinical trial. And then, of course, it facilitates research because it democratizes the ability for us to get the right patient in the right research study rapidly so that there isn't a delay. We can start therapy as soon as possible. We can
mhm,
provide access again and again and again. And when there's an option to participate in a trial, we need to know about it up front so that we can plan and leave as many doors open as we can.
mhm,
Yeah, first off, I hope that no one has to fight through a fragmented system like I did, where they're denied access to innovation. I think we all need to work together. There needs to be connectivity and communication between pharma, physicians, and patients. I think it's essential. Clinical trials must be presented early. I mean, I think maybe one of the only reasons I'm still here is my body was naive. I had never been treated before. I was teed up to do really well, whereas other patients that were on my study had failed out of other treatments and were weak and sick and maybe their immune system wasn't as healthy as mine.
mhm,
But I think consistently is developing pathways to make it easier for patients to find and qualify for clinical trials and be able to keep their community oncologists because that's kind of their warm blanket. That's what gives them security
Yep.
and and also give them the confidence to look outside the box, to work with an academic center when they know that if they don't understand something, they can go back home and talk to their community oncologist and get a clear picture of next steps.